curious about which food might be damaging your prostate health, you may be shocked to learn that some everyday foods could be contributing to your prostate issues. We're about to reveal the top culprits, and believe me, the food at number 3 will shock you because you eat it every day. Discover the hidden dangers in your diet and take control of your prostate health. Stay tuned to find out which food tops the list as the number 1 enemy to your prostate. Your well-being depends on it. First, we have red meat. Red meat, such as beef, lamb, and pork, contains high levels of saturated fats. These fats can contribute to inflammation in the body, which is a key factor in the development and progression of prostate enlargement. Inflammation can lead to the swelling of the prostate gland, exacerbating symptoms of BPH, and making it more difficult for men to urinate comfortably. Another harmful property of red meat is its high content of heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs. These chemical compounds are formed when meat is cooked at high temperatures, such as grilling or frying. HCAs and PAHs have been shown to damage DNA and promote cancerous changes in cells, including those in the prostate. This can increase the risk of prostate cancer, which can further complicate the management of BPH. Red meat is also rich in heme iron, a type of iron found in animal products. While iron is an essential nutrient, excessive heme iron intake has been linked to oxidative stress and the production of free radicals. These free radicals can damage cells and tissues, including those in the prostate. Oxidative stress is another factor that can contribute to inflammation and the progression of prostate enlargement. In addition to these chemical compounds, red meat can also contain hormones and antibiotics used in animal farming. These substances can disrupt the body's hormonal balance, potentially affecting prostate health. For example, excess consumption of hormones like estrogen from red meat can lead to hormonal imbalances that may promote the growth of the prostate gland. Furthermore, diets high in red meat are often low in plant-based foods such as fruits, vegetables, and whole grains. These plant-based foods are rich in antioxidants, vitamins, and minerals that support overall health and help reduce inflammation. A lack of these beneficial nutrients can make the body more susceptible to inflammation and oxidative stress, further worsening prostate health. One of the amino acids found in red meat, methionine, can be particularly harmful to the prostate. Methionine metabolism produces compounds like homocysteine, which has been linked to inflammation and oxidative stress. High levels of homocysteine in the body can damage the lining of blood vessels and contribute to chronic inflammation, which can negatively impact prostate health. Red meat is also associated with increased levels of insulin, like growth factor 1, IGF-1, in the body. IGF-1 is a hormone that promotes cell growth and proliferation. Elevated levels of IGF-1 have been linked to an increased risk of prostate cancer and the progression of BPH. This is because IGF-1 can stimulate the growth of prostate cells, leading to further enlargement and complications. Processed red meats, such as sausages, bacon, and deli meats, pose an additional risk to prostate health. These products often contain preservatives, additives, and high levels of sodium. Excessive sodium intake can lead to high blood pressure and kidney problems, which can indirectly affect prostate health by putting additional strain on the urinary system. Additionally, studies have shown that a diet high in red meat can lead to an imbalance in gut microbiota. The gut microbiome plays a crucial role in regulating inflammation and immune responses in the body. An unhealthy gut microbiota can contribute to chronic inflammation, which can impact prostate health and exacerbate symptoms of BPH. Next, we have ice cream. Ice cream, a beloved treat enjoyed by many, can have adverse effects on prostate health, especially for those with an enlarged prostate or benign prostatic hyperplasia, BPH. One of the primary concerns is the high content of saturated fats in ice cream. Saturated fats can contribute to inflammation in the body, which can exacerbate the swelling of the prostate gland and worsen BPH symptoms. The high sugar content in ice cream is another factor that can negatively impact prostate health. Excessive sugar intake can lead to weight gain and obesity, which are risk factors for BPH. Moreover, high sugar levels can cause insulin resistance and increase the risk of metabolic syndrome, further complicating prostate health. Dairy products, including ice cream, contain hormones like estrogen and insulin like growth factor 1, IGF-1. These hormones can disrupt the body's hormonal balance, potentially promoting the growth of the prostate gland. Elevated levels of IGF-1 in particular have been linked to an increased risk of prostate cancer and the progression of BPH. The presence of artificial additives and preservatives in ice cream can also be harmful. These chemicals can trigger allergic reactions and inflammation, which can further strain prostate health. Additionally, some additives can disrupt the gut microbiota, leading to an imbalance that can negatively affect overall health, including the prostate. Ice cream is also high in calories, and frequent consumption can lead to weight gain. Excess body weight, especially around the abdomen, can put additional pressure on the bladder and exacerbate urinary symptoms associated with an enlarged prostate. Maintaining a healthy weight is crucial for managing BPH effectively. The high levels of lactose in ice cream can be problematic for individuals with lactose intolerance. Lactose intolerance can cause digestive issues like bloating, gas, and diarrhea, which can indirectly affect prostate health by causing discomfort and inflammation. Opting for lactose-free alternatives can help mitigate these effects. Another concern is the potential presence of antibiotics and pesticides in dairy products used to make ice cream. These substances can disrupt the body's natural balance and contribute to antibiotic resistance. Additionally, exposure to pesticides can increase the risk of developing chronic health conditions, including those affecting the prostate. The frequent consumption of ice cream can also lead to high cholesterol levels. High cholesterol is associated with an increased risk of cardiovascular disease, which can indirectly affect prostate health by impairing blood flow and causing inflammation. Managing cholesterol levels through a balanced diet is essential for overall health and well-being. Ice cream can also contribute to dehydration due to its high sugar content. Dehydration can lead to concentrated urine, which can irritate the bladder and exacerbate urinary symptoms associated with BPH. Staying hydrated by drinking plenty of water is important for maintaining prostate health and reducing discomfort. Next, we have dairy products. Dairy products, including milk, cheese, yogurt, and butter, are widely consumed for their nutritional benefits. However, for individuals with an enlarged prostate or benign prostatic hyperplasia, BPH, these products can have adverse effects on prostate health. One of the primary concerns is the presence of hormones in dairy products. Cows are often treated with hormones to increase milk production, and these hormones can disrupt the body's hormonal balance, potentially promoting the growth of the prostate gland. Dairy products are also high in saturated fats, which can contribute to inflammation in the body. Chronic inflammation is a key factor in the development and progression of BPH, leading to worsening symptoms. Saturated fats can also raise levels of low-density lipoprotein, LDL, cholesterol, which can negatively impact cardiovascular health and indirectly affect prostate health. The high calcium content in dairy products can be problematic as well. Excessive calcium intake has been linked to an increased risk of prostate cancer. High levels of calcium can inhibit the body's ability to absorb other essential nutrients, such as magnesium, which is important for maintaining prostate health. Additionally, excess calcium can lead to the formation of kidney stones, further straining the urinary system. Lactose, the sugar found in dairy products, can cause digestive issues for individuals who are lactose intolerant. Symptoms such as bloating, gas, and diarrhea can indirectly affect prostate health by causing discomfort and inflammation. Opting for lactose-free alternatives can help mitigate these effects. Dairy products also contain casein, a protein that some individuals may have difficulty digesting. Casein intolerance can lead to inflammation and immune responses, which can negatively impact overall health, including the prostate. Reducing the intake of dairy products can help manage these symptoms and support prostate health. The presence of antibiotics in dairy products is another concern. Cows are often treated with antibiotics to prevent infections, and traces of these antibiotics can end up in dairy products. Over time, the consumption of antibiotics can disrupt the gut microbiota and contribute to antibiotic resistance. An unhealthy gut microbiota can lead to chronic inflammation, which can exacerbate symptoms of BPH. Dairy products are also high in calories, and frequent consumption can lead to weight gain and obesity. Excess body weight, especially around the abdomen, can put additional pressure on the bladder and exacerbate urinary symptoms associated with an enlarged prostate. Maintaining a healthy weight is crucial for managing BPH effectively. The high levels of insulin like growth factor 1, IGF-1, found in dairy products can also be harmful. IGF-1 is a hormone that promotes cell growth and proliferation. Elevated levels of IGF-1 have been linked to an increased risk of prostate cancer and the progression of BPH. Consuming dairy products regularly can lead to higher levels of IGF-1 in the body, potentially promoting the growth of the prostate gland. Dairy products can also contribute to dehydration due to their high protein and sodium content. Dehydration can lead to concentrated urine, which can irritate the bladder and exacerbate urinary symptoms associated with BPH. Staying hydrated by drinking plenty of water is important for maintaining prostate health and reducing discomfort. Next, we have caffeine. Caffeine, found in coffee, tea, soda, and various energy drinks, is a widely consumed stimulant. However, for individuals with an enlarged prostate or benign prostatic hyperplasia, BPH, caffeine can have several harmful effects on prostate health. One of the primary concerns is caffeine's diuretic effect, which increases urine production and can exacerbate urinary frequency and urgency. This can be particularly bothersome for men with BPH, as it can lead to more frequent trips to the bathroom and disturbed sleep. The stimulating effect of caffeine can also lead to the contraction of the bladder muscles. This can cause a sudden urge to urinate, making it difficult for men with BPH to control their bladder. The increased bladder contractions can also result in incomplete emptying of the bladder, which can worsen urinary symptoms and increase the risk of urinary tract infections. Caffeine has been shown to increase levels of epinephrine, a stress hormone, in the body. Elevated levels of epinephrine can lead to increased blood pressure and heart rate, which can put additional strain on the urinary system. This added pressure can exacerbate the symptoms of an enlarged prostate and make it more difficult to urinate comfortably. The consumption of caffeinated beverages can also lead to dehydration. Caffeine is a diuretic, which means it promotes the loss of water from the body. Dehydration can cause concentrated urine, which can irritate the bladder and worsen urinary symptoms associated with BPH. Staying hydrated is important for maintaining prostate health and reducing discomfort. Caffeine can also interfere with sleep patterns, leading to insomnia or disrupted sleep. Poor sleep quality can have a negative impact on overall health and well-being. For individuals with BPH, disrupted sleep can worsen urinary symptoms and contribute to fatigue and irritability. Managing caffeine intake can help improve sleep quality and overall health. Another concern is the potential effect of caffeine on hormone levels. Some studies have suggested that caffeine can influence the levels of certain hormones, such as testosterone and cortisol. Hormonal imbalances can affect prostate health and potentially promote the growth of the prostate gland. Reducing caffeine intake can help maintain hormonal balance and support prostate health. Caffeine can also increase levels of oxidative stress in the body. Oxidative stress is caused by an imbalance between free radicals and antioxidants, leading to cell and tissue damage. This can contribute to inflammation and negatively impact prostate health. Antioxidant-rich foods and beverages, such as fruits and vegetables, can help counteract oxidative stress and support overall health. The high acidity of some caffeinated beverages, such as coffee, can also be problematic. Acidic beverages can irritate the lining of the bladder and urethra, leading to increased urinary frequency and urgency. For men with BPH, This can further exacerbate urinary symptoms and cause discomfort. Opting for low-acid alternatives can help reduce irritation and improve urinary health. Caffeine can also interact with certain medications used to treat BPH. Some medications may increase the effects of caffeine, leading to increased side effects such as jitteriness, anxiety, and palpitations. It is important to consult with a healthcare provider before combining caffeine with BPH medications to ensure safe and effective treatment. Last, we have alcohol. Alcohol consumption, though enjoyed by many, can have detrimental effects on prostate health, particularly for individuals with an enlarged prostate or benign prostatic hyperplasia, BPH. One of the primary concerns is that alcohol acts as a diuretic, increasing urine production and exacerbating the symptoms of BPH. This can lead to more frequent and urgent trips to the bathroom, causing discomfort and interrupting daily activities. The dehydrating effect of alcohol is another factor that can negatively impact prostate health. Dehydration can cause urine to become more concentrated, which can irritate the bladder and urethra. This irritation can worsen urinary symptoms associated with an enlarged prostate, making it more difficult for men to urinate comfortably. Alcohol can also affect hormone levels in the body. It has been shown to increase levels of certain hormones, such as estrogen, which can disrupt the hormonal balance and potentially promote the growth of the prostate gland. Hormonal imbalances can complicate the management of BPH and lead to further enlargement of the prostate. The inflammatory effects of alcohol are well documented. Chronic alcohol consumption can lead to inflammation throughout the body, including the prostate. Inflammation is a key factor in the development and progression of BPH, and reducing inflammation is crucial for managing prostate health. By avoiding alcohol, men can help reduce the inflammatory burden on their prostate. Alcohol can also have negative effects on cardiovascular health. It can increase blood pressure and lead to the development of cardiovascular disease. Poor cardiovascular health can impact blood flow to the prostate, exacerbating BPH symptoms and making it more difficult to manage the condition effectively. The presence of toxic byproducts from alcohol metabolism can also harm prostate health. Acetaldehyde, a byproduct of alcohol metabolism, is a known carcinogen and can damage cells and tissues, including those in the prostate. This can increase the risk of prostate cancer and further complicate the management of BPH. Alcohol can also impair the immune system, making the body more susceptible to infections. For individuals with BPH, a weakened immune system can increase the risk of urinary tract infections, which can further irritate the prostate and worsen urinary symptoms. Maintaining a healthy immune system is important for overall prostate health. The high calorie content of alcoholic beverages can contribute to weight gain and obesity. Excess body weight, especially around the abdomen, can put additional pressure on the bladder and exacerbate urinary symptoms associated with an enlarged prostate. Maintaining a healthy weight is crucial for managing BPH effectively and reducing the risk of complications. Alcohol can also interfere with the effectiveness of medications used to treat BPH. Some medications may interact with alcohol, leading to increased side effects or reduced efficacy. It is important for individuals with BPH to consult with their healthcare provider before consuming alcohol while on medication to ensure safe and effective treatment.